Good afternoon, everyone. Greetings. Welcome to the National African American Child and Family Research Center's Research Capacity Building webinars. This month, we are going to be focusing on measuring and achieving equity in program research. We are so excited to have our guest here today. Again, welcome you all to our webinar. I am going to stop sharing for the moment to introduce our moderator for the session. Our moderator is Dr. Robert Mayberry. He is a nationally noted scientist, scholar, and opinion leader in health disparities and health equity research. He is a professor and former vice chair of the Department of Community Health and Preventive Medicine at Morehouse School of Medicine. And he also serves as the director of Morehouse School of Medicine's Research Design and Biostatistics Core. He serves as an expert consultant and scientific reviewer for academic, private, and federal organizations, and also a reviewer for peer-reviewed scientific journals. As a teacher and mentor, he was awarded the Abraham Lilienfeld Award by the Epidemiology section of the American Public Health Association for his excellent contributions to the teaching of epidemiology. And so because of that greatness and excellence, he serves as the co-lead for the capacity building section of the National African American Child and Family Research Center. So please let us turn our attention to Dr. Robert Mayberry.
Thank you, Dr. Rollins. I hadn't read over my bio sketch in a long time, so thank you for picking out a few things for me. I'm delighted, thank you, and I'm delighted to be here. Dr. Balu and I have already started our discussion, so I'm looking very forward to her presentation. And one of the reasons I'm looking very forward to her presentation, because I think she's advancing in her presentation, and what I can see from the slides that she's shared with me earlier, advancing our discussion very nicely in the whole area of equity, and it has application, of course, to health equity and the broader field as well. But without further ado, let's move forward. I'm going to be the moderator that does my job up front and then get out the way, and then I'll come back maybe with a couple of questions here and there to keep us rolling forward. But Rekha Balu is Vice President of the Office of Race and Equity Research and Director of Federal Equity Initiatives at the Urban Institute. She has worked with government agencies around the country as a program evaluator and technical assistance provider on education, community engagement, and human-centered design. At the Urban Institute, she leads mixed methods, collaborative research projects on policies, ranging from human service to education to retirement policy. She holds a PhD in economics of education from Stanford University, and serve on the board of the Society for Research on Educational Effectiveness. Dr. Balu, it's a pleasure to have you today. The floor is all yours.
Great. Well, thank you again so much for having me. I've long admired the work of the center. I've been coming to these seminars myself and have been learning so much. And so I'm really here just to build on the knowledge that has already been shared and talk a little bit about some of the work that we've been doing to try to make this concept of equity concrete, which I know can be a little abstract, and think about how does this actually work in government settings where we know that data and staff and time may not be what it is in academia to really get to the kind of level of measurement that we want, and yet amazing strides have happened, in recent years. So I'll talk briefly about a project that my team and I have been doing, working with federal agencies around some of their government equity plans and planning process. That'll set up a conversation about some various measurement choices that they and we as researchers get to make, and that will tee up just kind of a very high level kind of analysis framework that I hope to leave you with today, and definitely welcome your feedback and thoughts on. So just to give a sense of like who I am and where did all of this thinking come from. So as many of you know, the Biden-Harris administration had these day one executive orders on equity that were introduced when they took office in 2021, and then they issued follow-up orders later that year and in 2022. And the executive orders are broad and comprehensive, and they defined equity largely in terms of fair and impartial treatment. rather than outcomes. And so that led them in a way to actually focus on what they called underserved populations, persons adversely affected by persistent poverty or inequality. There was a way in which they were trying to identify who had the greatest need and who policy had harmed or ignored. And we can share this link to this definition that ACF also released in 2022 for your reference later on. And essentially, these executive orders called on agencies to create equity plans. And the structure of those plans had not necessarily been laid out, but it was a call to make a commitment. And we can think of these kinds of equity goals and commitments as a starting point, and almost as like a whole of government intervention, like this natural experiment that happened, where there had not necessarily been kind of common training across all the agencies to think about this, to think about what's the difference between equality and equity, to think about types of equity. And until these executive orders came around, there had been maybe different pockets of thinking across the federal government, and ACF had certainly been in the lead on a lot of this. But then suddenly there was this call to action and this set of public documents that kind of serve as commitments and perhaps accountability tools as well. But it also means that we're in the early stages, as many of you researchers know who work on 5- and 10-year research projects, you can kind of think about this as like us being in year 2 of this natural experiment, where we're all still figuring out what even are these concepts, and therefore, how would we go about measuring them? And this is going to be an iterative process, and that is essentially what we've been doing with our various agency counterparts who we've been fortunate enough to work with across the federal government, and to some extent in state and local governments. But today I'll focus our conversation on kind of the work we did at the federal level. So you can see that kind of executive orders themselves are our commitments, and then the agency plans. We sort of distilled from that these different pathways to equity and found that the stronger plans essentially had these multiple pathways to equity. And some of you will recognize these concepts from the public management literature. Some of you have seen them elsewhere. We essentially identified that there were these 3 types of equity that were consistently showing up across these strong plans. So one of them is this procedural equity notion, that essentially the processes that government administers, which is the primary way that many of us interact with government. We apply for something, we participate in a program for which we're eligible, that those processes are fair. And there was a specific early executive order that really emphasized these processes. But of course, a lot of what the federal government does, as you all know, is distribute funds to grantees and to individuals. And that distributional equity has also come to the fore, not just because of the various government procurement processes that allow us to have these research centers and research contracts with the government, but also if you think about the Build Back Better efforts that we're trying to distribute funds for childcare. You think about the amazing the quantity of infrastructure funds that have been released in the last couple of years. The goal of that isn't just to get money out the door, but if it's achieving distributional equity, ideally, those are also changes that are about reallocating the burdens that communities have been encountering so that the resources and the burdens are hopefully, as resources increase, burdens are decreasing. And ultimately, what we hope to be achieving kind of lasting equity is that this more structural form of equity, that the policies, the program structures, the incentives that are in place that are embedded within programs and practices, that those are shifted in ways that could actually remedy past harms and improve outcomes. And so, of course, these ideas don't just appear in equity action plans, they also appear in evaluation plans, strategic plans, many other documents that government publishes. And so we kind of tried to look at these collectively while focusing on the equity plans as a starting point, kind of as our source documents in our data set. And so I won't get into all the details with you, but just to say, we started with the rubric, pulled it within that rubric. We had things we were coding for that had appeared in prior equity audits and other kind of gray literature that had been kind of trying to operationalize and put into practice these concepts, just sort of because that's essentially what we were looking at. To what extent was government able to put into practice some of these ideas that would actually be supporting their equity goals? Then we summarized plans and the metrics that were contained in the plans for about 20 to 24 agencies and commissions. And then we put those into these digests that you see here. Then we synthesized those in a report that was released. We can drop all of these links in the chat so that you have them toward the end of the talk. And in there, we tried to highlight these common tactics that we saw in both the commitments and the kind of ways that agencies talked about how they were going to achieve those commitments. And then we tried to highlight some potential new strategies that agencies could be considering for their 2023 plans as we were synthesizing the 2022 ones. And ultimately, of course, what is the point of all this work? It's translation. So we conducted workshops with agency equity leads to really get them to start thinking about, okay, you've got these initial commitments. How do we move them from being input-oriented to being output-oriented to being focused on outcomes? And so that this structure will not be surprising to any of you who are researchers here who have developed logic models for the interventions that you evaluate and study. And that's kind of how, going back to where I started, thinking about this whole set of equity commitments as being almost like an intervention that then needs a logic model in order to get to and specify what those outcomes are. And just to say that as we were reading through the plans, we saw a lot of mention of what you might call in the inputs and activities section of a logic model. So things like, we're going to reach out to these specific populations. And these examples that we have here in quotes are all excerpts from actual plans that you'll see again, and we can provide links to the digest that we compiled. Then some plans actually started to move, even at their early stage, were discussing outputs and you can think about these as kind of the intermediate performance goals. So how many applications were received, how many grant awards were dispersed, and because those are not equity in and of themselves, but they are indicators of what is happening and what movement is happening. And so we did see a lot of examples of things like, we're going to track the number of complaints filed because that would get at where burdens are, or they're going to track the number of first-time grantees because that would help illustrate for them whether they've expanded the base of people who are either receiving government grants and loans or otherwise participating in these processes. But ultimately, to get to kind of the end goal, we're really looking at, and we're working with and talking with people in government about what are the outcomes that one could reasonably expect to come from tracking these intermediate performance measures. Do those outcomes have a clear direction? Do they have a clear time frame for change? Do they specify strategies for progress? So, there in several agencies, there were calls to increase the share of contracts that were awarded to small and disadvantaged businesses. Sometimes they specified a year, sometimes they didn't, but you could see these were starting to be early examples of where people would actually have a sense of what would be the outcome that would reflect some improvement resulting from these equity commitments. So then now we arrive in 2023, we saw the 2023 plans released, and we then thought, oh, well, we could use both years as source documents for machine learning, and we could think about what might be patterns that we're seeing across agencies in terms of both the way that they express and define equity. Is that definition changing? And also, how are they making progress or making a different set of commitments? So we decided to just apply some basic text mining to see these patterns. For those of you who've done this, we then had to create these dictionaries for what we thought were key concepts and how we might define equity, both based on how the executive orders had done it and how you might also expect to see it expressed. And these are just some of the high-level findings from the text mining of those plans. And so not surprisingly, because 2023 was a year where a lot of those federal infrastructure dollars had to get out the door, definitely saw more emphasis on the distributional equity concept, thinking back to those 3 types of equity that I shared earlier. We saw a lot more conversation around prioritization of interagency collaboration, which maybe reflects more of a recognition of the implementation coordination that's required to reduce barriers, reduce burdens, and actually target key populations. And also part of targeting key populations who have potentially been underserved or harmed by government is really thinking more intentionally about the community engagement in program design, research, and other forms of decision-making. And then we saw sort of signs of these progress metrics, as I kind of showed you before, and I'll show you some more examples of now. So all of that kind of gets me to the place of thinking about, okay, what does this tell us about measurement of equity and how government might get to an equity measure as compared to, or in the context of also how researchers and advocates are talking about what equity actually looks like and how to make, what is a count of that. So to do that, I think about there needing to be alignment between policies and measures. And so there's a continuum of policies and programs that are kind of our starting point before we launch into measurement. And I think you can think about I think about this continuum. This is an oversimplification, of course. Government is much more complex than this, doing many other things, but just for our conversation today, that continuum kind of, you can think about it starting with a focus on these performance measures. So are there customer service hotlines? What are they? How many people are they serving? How many people are they helping actually do things like apply for funds? And then you can think about there being kind of equality-focused policies and programs also, which is, okay, we've realized rural communities have not been receiving as much money as urban communities, so we need to make sure that we're actually dispersing funds in a way that is specifically addressing the needs of rural communities. And you can kind of think about that as sort of an equality-focused policy or program. And then we could keep moving down this spectrum and think about what might an equity-focused policy look like? And if we go back to those definitions that were in the executive orders, there were things about reaching communities that had been underserved. And that might suggest then that the policy itself is targeting funds, and in ways that might not be about comparability, the way equality is, but might be about greater support and targeting of funds to organizations and communities that specifically have not been able to apply before, really recognizing who has been excluded, who has been shut out, what has that harm been, and trying to address that. And then ultimately, when government is working well, I think we get these more justice-oriented policies. So I think one of the key example and a recent example of this is thinking about the U.S. Department of Agriculture had recognized the history of discrimination against farmers, particularly Black farmers, created this discrimination financial assistance program and dispersed funds that were intended specifically to compensate people who had been denied loans unfairly. So this is the spectrum or continuum of policies that we have. And needless to say, there are more policies and programs at this end of the spectrum than there are kind of on this equity and justice side. So given that, what does that tell us about what kind of measures then people might be thinking of when they're running a government program and how they might measure equity in that program? And it's needless to say harder, but it is possible, of course, to measure equity in any case, but it is harder when the policy or program is not doing the kind of targeting and focus on and recognition of who are the people who have been left out. And here we're thinking about equity as being about this just basic concept of fairness and making sure that we're redressing that unfairness that policy and government programs in particular had created. So now let's think about what that suggests to us about what the continuum of measurement might be. So on that same, if I take the same kind of 4 categories, recognizing it's a bit of an oversimplification, who really has to report on performance? And that's government, right? They have to keep these tallies, sometimes because they are required to by statute, sometimes because it is just good accountability for the amount of money that it oversees. What is and these could be really basic things like the number or share of the people served. And then they could also take on kind of more equality focused measures and say, hey, for the people we serve, what's the difference? What kind of difference in experience or difference in outcomes are they experiencing at a point in time. And they could pick groups based on individual demographic characteristics, based on time, based on other characteristics, and make those comparisons. But they are really point in time comparisons for most equality measures. But as we've just talked about, right, equity is about thinking about what is this history of exclusion or harm that has happened, and how do we address that with policy going forward, and then what is the measure that really captures that. And so I think this is really where researchers have stepped in and created some amazing literature. I mean, the health equity literature is obviously so strong on this point about thinking around what is the improvement in outcomes over time that needs to occur for those who have been most harmed by policy. And how do we measure what that improvement is? What is the scale of that improvement that would actually be sufficient? These are all the questions that are kind of in discussion and contention in some spaces right now. And then if we think about what would we measure for a justice-oriented policy, this is really where advocates are calling for measures that are more about redress for the decades of policy harm, and measures that actually capture whether there has been prevention of new harm. So what does this look like for all of you people who really want to know, okay, what does this look like in terms of a calculation? So I mean, an equality measure often is about an average effect. And even when we're looking at heterogeneity, it's usually in individual outcome levels and often at a point in time. I'm obviously making some generalizations here. There are lots of exceptions to this, but just to say on average what we're seeing in the literature. And an equity-focused measure, I think part of what we're starting to see is more discussion about, okay, in this distribution across income deciles, across health outcome deciles, what does that look like? And does that distribution ever change in rank order? If the policy is doing its job, shouldn't people who have been in the bottom decile for decades actually start to be improving outcomes faster? That could be one way to think about this. Could also be like measures of dispersion and seeing whether there's less dispersion in a tighter range. Or we could see that over time, we're starting to see change in the trend line and the slopes. I'm sorry, I'm not monitoring the chat. So if folks have questions, feel free to ask Latrice to share them with me. And if you need me to slow down, please feel free to say so. And then for these, I think to get at measures of redress, I think we're still very much thinking through this, and this is really where researchers and advocates can be working more closely together. And as many of us know, conceptually, we want to be at a place where race no longer predicts outcomes. And I think that's both outcome levels and the future trends and slopes, right? It's not enough that we have resolved this problem today, or we resolved it for what the past decades had done, but that we've also done something to this prevention of new harm concept about could we simulate or predict what this future trend could look like if race were no longer, or disability or gender were no longer predictive? And if that correlation between individual demographics and outcomes were really heading towards zero. So let me show you some examples of how these measures have actually shown up in plans as they concern specific programs that many of you probably know well and study. So as I mentioned, we looked at these 2022 and 2023 plans. So for Medicaid, there in 2022 was already obviously a lot of attention paid across various government documents, both from CMS specifically and from HHS more broadly, to think about efforts, as they said, quote, efforts to reduce maternal mortality as measured through postpartum coverage expansion in the Medicaid and children's health insurance programs. And so if one wants to be, one could think about those as like, okay, what are the activities that are necessary to get this coverage expansion? And one might think of that as being more of an activities or outputs orientation, moving toward an output. Then in the 2023 plan, they started to talk about change and the change they'd like to see. And one of the measures that was included was changes in impact in the number of people who benefit from this expanded Medicaid postpartum care. That is reflecting more of an outcomes orientation. Now, we could say there could be specific target numbers attached to that. There could be other things, but the point being that you can see as time goes on, there is a shift. And then, as many of you know, at the end of 2023 and early 2024, many states had then started to expand their postpartum coverage to a full year, to a full 12 months. And many of our health policy colleagues at Urban contributed research that really informed the many states' decisions to extend this and take advantage of this extended coverage. So this is one way you could start to think about, okay, we're thinking about who needs postpartum care the most. People who have lower incomes and are on Medicaid and are probably not getting this coverage from their employer, certainly not to this length of time. So to what extent can this program actually be the way that closes some of those coverage gaps? So now let's take a program within ACF's purview, the Low-Income Home Energy Assistance Program. So one of the goals that had been set in the performance plan for fiscal year 2023 was this goal of reducing energy burden among the most energy burdened households. And I chose this example because I think burden measures are something we're starting to see across more government documents, and it reflects more of an understanding that that it's not just about cost. It's really about what do those costs represent as a share of income. And in this case, this energy burden is measured as like the cost that a household incurs for heating, cooling, other utilities as a share of overall income. And so then they created this measure, which they called a burden reduction targeting index or score, to then have states report out who are the high energy burden recipients in their grant receiving pool. And are those higher energy burden recipients receiving more benefits or more reduction in burden essentially than others? And this starts to reflect that idea that I had shown before about, well, if we're targeting those who have been most harmed or those who have been excluded, whether by this program or in the labor market more broadly, then ideally there is greater improvement happening for them. And so that's what this measure ideally would be capturing. So does this meet our criteria for both like an equity-focused policy and an equity-focused measure? I would say tentatively, yes. At least it meets some of those criteria about the targeting, and it meets some of those criteria about a measure that's really capturing improvement for those who are most harmed. So now let's think about a program like Temporary Assistance for Needy Families, TANF, something that I know many of you study. In the goal that had been set for this program was to increase the median state share of funds that are used for these work, education, and training activities. Essentially, our recipients being able to move off of TANF into employment and stay employed, and not only stay employed, but increase their earnings so that they no longer are returning to or needing cash assistance in this particular program in this way. So this measure is a share of state spending, and to set this performance goal and target, they chose a baseline year and used historical data to set a target. So I'm gonna now throw this open to you all and ask you to maybe put in the chat, do you think this criteria, how do you think the criteria were met for this? Is this policy an equity-focused policy? And is this measure an equity-focused measure? So feel free to drop your ideas in the chat and ideally explain a little bit of why or an open question that you have.
You have one no.
And maybe that no is the resounding no for everybody who is watching, or maybe that is people thinking about, right, is this going far enough? And I think the point is that this is exactly the thought exercise we want to go through, right? And the point isn't just to say to a government agency or program, hey, this isn't an equity-focused measure. the point ideally is to say, here's a way that we could work with you to identify who has been most harmed. How might we create more visibility on what that harm has been? How might we understand what it would take to be really remedying that exclusion? And how might we measure that with the data that are available, recognizing that not government data sets are not always as complete as we would like them to be. So to answer a question that's in the chat, and I appreciate people putting questions in the chat and ideas here. In this case, I think the way they were talking about this share of state spending, I think you could think about it different ways, but I think this is related to that maintenance of effort concept within the TANF program. So, but it's interesting to think about whether it could also serve as another kind, thinking about burden to the states, not just burden to the individuals. And Dr. Mayberry, I saw you come on video.
I'm always tinkering with my Zoom, but I did have a kind of an extension of what to your question. I think this could possibly be very meaningful from a federal perspective. In other words, the share of state spending might be very meaningful from the federal perspective. But if you have persons, say, within the state of Georgia and they're on the ground, what would that mean for them? Because oftentimes when we are engaging and advocating for, we are looking at what is happening on the ground and how our neighborhoods and individuals began to benefit from. And that's where I think we are trying to get to, but we recognize that there's some higher level thinking. And in terms of distribution, obviously there are some distribution issues at the federal level that have to take place at the state, but eventually it trickles down to the local levels. And that becomes more meaningful from a pragmatic, programmatic level, and perhaps even a sustainability level. Just a thought, if you wanted to extend on that.
Absolutely. And I think that's also one of the questions we want to bring whenever we see a measure is, who is this measure for, right? Is this a measure that helps people at one level of government monitor something, but not necessarily would it not necessarily transfer the same kind of knowledge to people at other levels of government or communities who may want to monitor what's happening, or recipients themselves? And so I would say, like, as we start to think about what is not just an equitable outcome that results from a program, but what is an equitable outcome measure, ideally, it would be something that could speak to these different audiences and create a kind of usable knowledge that many different audiences and constituencies could work with. So I'm sure some of you are like, this is all fine and well, but now tell me, what is my data collection plan and what is my measurement plan? So I would say, to Dr. Mayberry's point about thinking about the questions and the extensions that we might want to bring, thinking back to that continuum that I showed you about the continuum of measures, that continuum was meant to say that ideally, over the course of a research project, over the life of a research project, we're actually able to understand all of those places in the continuum, right? We do want to understand performance in terms of individual experiences. We do want to understand whether there is at least some basic equality that had in experience or outcomes or funding or outcomes. And then, but ultimately we want to move beyond that to think about what is the data that we need to then be able to get to some of those equity measures where we could do that kind of more distribution level, across the distribution look at who is receiving what, and is that ordering of who is receiving the most remaining the same over time. So I'm just offering these as some suggestions for like the ways you could think about the different data that you might want to, the different purposes you might have, the different measures you might have, and therefore the different data that you might want to collect. So if, for example, to understand differential barriers and burdens, to understand the actual experience of that, maybe that's a survey of individuals, which are also doing something in that survey that's getting at what were the structures and systems that created these burdens, and how are they experiencing those structures and systems in ways that are burdensome. Of course, a lot of us work with administrative data, and that can sometimes allow us to examine like the distribution of funding, for example. But is that distribution of funding at the community level, at a higher government level? Is it something that really allows us to understand distribution at other levels as well? So I think a lot of us think about equity as like being about closing gaps. And I would encourage us to think about whether we are trying to view gaps as gaps in outcomes at a point in time, or gaps in the trend line of outcomes over time, and whether those gaps could continue. And that's where these simulations, I think, can be useful to think about, based on past data, what might the future trends look like. So as we're coming to the kind of end here, I'm just going to say, you might think about like, then what is those questions are nice, those measures are nice, but what's like the series of analysis decisions that I need to make? I think some of that starts with like, always like, what is going to be your unit of analysis? What is the focus of that analysis? It's fine to be doing a disparity analysis if that is your goal. I think what we are trying to encourage everybody to do here and work with our government agencies to do is to say, that's a great starting point. Now, how can we kind of move that along that continuum toward being something where we're also able to look at the unfairness and the inequity as being the focus of the analysis, and what would that take? And so that's where these data collection questions come in, and where we think about whether we're just collecting data in the present, whether we need more historical data, by which characteristics do we need that? And then thinking for our analysis and interpretation, I know many of us are in programs who are trying to, and being told we need to get a causal estimate, and that's really the only estimate that matters. And we should certainly strive for that, but then it's thinking about, well, what is the causal effect of? Is it the causal effect of a single policy? And do we really think that single policy is sufficient to resolve these longstanding inequities and injustices? Probably not. And that is often then why I think we end up sort of resorting to talking about closing gaps at a point in time, because that's what we've been that's what that single policy is oriented to. But ideally, if we're really taking into account many of these like structural factors that many speakers before in the seminar have addressed, ideally we'd be getting to this place where we're estimating more of the cumulative effects of multiple policies over time, and that gets us toward that trend in outcomes. And so this is just to kind of say why, if going back to that slide where I had my continuum of measures, why we're really thinking about that as being about like both very much an overtime phenomenon and not just a kind of today and now situation. So these are just some discussion questions to get us started. There are obviously many more. Dr. Mayberry certainly has some, but I just want to thank you all for joining today at the end of a long day. And thank you so much for your time and attention. And please feel free to keep putting more questions in the chat. And I think to answer Mariella's question, absolutely, I think on that continuum and that spectrum of justice, intersectionality is critical in that, because if we're just in the same way that if we're just looking at a single policy, we're missing a lot of the story. If we're just looking at a single characteristic, we are missing a lot of the story of how harm has been done, I think, particularly to women of color, and certainly many of the programs that we're all here studying.
Dr. Balu, I think you have a wonderful piece of information, bits and pieces of wonderful information here, quite robust, provocative in many ways, and I think is very helpful, because I think it's advancing us forward and how the federal government thinks forward, but how we all kind of think forward in achieving equity, and obviously trying to get to that level, the higher level of justice as well. There are a number of comments that have come in already in the chat, and I think there will be some additional questions coming in the Q&A box. If you don't mind, I'd like to kind of step back for a moment and mention a couple of things and kind of applaud you on doing so. I understood very clearly what under-resourced mean, underserved mean, and disadvantaged, because you gave good definitions of it. And the reason that I say that is that I oftentimes go into a meeting And oftentimes we're wanting to discuss achieving health equity, and everyone wants to kind of reduce it down to the disadvantage without giving any quote definition or even a context. So thank you very much for putting that one forward. So I think that's very helpful. You mentioned equity conceptually as fairness, and these broad discussions that we have as a matter of routine. I think that's where most people understand equity to be as well. I think we could probably extend it a bit, because if you were to ask me how would I measure fairness, I would probably respond fairness in what domain,
Exactly.
what area, and so forth. What would it mean if achieved? And so I would probably approach it from that level. In the health services arena, we often refer to equity in terms of optimum health. And then we might make an extension in discussion in terms of how health care provisions are provided, for example, and we'll use a term according to need. Care is provided according to need. So there's an extension of the definition. But I wanted to revert back to the example that you gave with the Black farmers. If we were trying to achieve equity, the Black farmers represent, and farmers of color would represent that group that did not receive federal funding at a level of need.
Yes.
And oftentimes did not receive funding at all for numerous reasons. So now the question is, what would equity mean in that context if they start to get federal funding at a level to keep their funds? But what would it mean at that level? Because now we're talking about how do you restore that which has been lost?
Yes.
Does the federal government have a role? So to understand that, does equity extend beyond just simply providing to that under-resourced group or underserved group, but does the federal government has a responsibility to extend beyond just that domain of equity?
It's such an important question. And I think it also gets at, eventually, if we are doing this right in both policy and research, the underserved groups will not remain underserved in perpetuity. So that, and I think thinking about like, okay, at what time point, and this is a little bit of where my question about what's the duration or time horizon for seeing meaningful change comes. It's like, at how long will it take for us to get to the place where we have now met that level of need that's been identified and are going to consistently meet it, so that then this is not an underserved, underfunded, under-resourced group. And, there is a time horizon on that because we have long appropriation cycles and we have, large programs that take time to disperse funds. And yet I think that putting that question on the table, I think starts a very different kind of conversation that puts different measures on the table in terms of accountability. And then I think gets us into thinking about, okay, well, if this can't happen in 5 years, what is the thing that can happen in 5 years? What is the thing that can happen in 2 years? What are other mechanisms and instruments of policy and government that we can take advantage of?
Related to a second question for me, and then we're going to go to the chat box or even to the Q&A. I'd like to take the issue of maternal mortality just for a moment. And I think, and this is a clarification question as well. I think you were alluding to maybe we'll get to a point where race would not be a consideration or race would not be, quote, the determining factor. But if we were to deal with the issue of wanting to reduce maternal mortality, is race a determinant of the beginning of the effort to reduce maternal mortality? Or how would race as a variable be incorporated in the effort from the federal level?
It's this dilemma of like, in the now, it is very predictive. And in our history, it has unfortunately been very predictive of maternal mortality. And so then it makes sense I think for that targeting that we were talking about in like what's an equity focused policy, it would be targeted based on like whatever the characteristics are that reflect the exclusion, harm, neglect that that's happened. And yet thinking about what is the set of like program and structures and services that would help get to the place where no mother is dying at all, right? In childbirth is obviously our end game. And it's not just that race no longer predicts this outcome. It's also, I think in this case, that this outcome is not a prevalent outcome anymore or a high incidence outcome anymore. So I think that presents its own kind of urgency and opportunity, right? And thinking about like I think sometimes, we say, oh, well, not every student can get an A in class. Not every person can be, a wealthy millionaire. But I do think on outcomes like maternal mortality, I think we can all agree, like nobody should be in this country dying in childbirth. And so it then creates a nice reference point to work from, to say, we know what our target is. We don't have to debate that target. And so now what will it take in terms of investments, in terms of mobilizing new kinds of continuum of care, new programs, so that no longer is, that we're moving that outcome closer and closer to the zero that it should be.
Yeah, I do think I would agree. And I would just like to extend just for a quick moment here. If I were looking at maternal mortality in the state of Georgia, I would certainly have race as one of those determinants. But of course, I'm trying to define the problem. I would have far more than race. I would have all of those variables, which I believe are determinative of maternal mortality. But the bottom line, as you have alluded to as well, is that we're trying to get to prevention. What does prevention look like on the other end? So we may actually start out with however we define the problem. Maybe it's a racial ethnic issue because we know all of the variables that come into quote being Black, white, brown, or others. So we might actually start looking at variations in maternal mortality by race, ethnicity. We can achieve some level of equity, not equal mortality rates, but equity along the way. But I think we will be satisfied at the end of a period of time that we don't see race, ethnicity as a determinant of maternal mortality. But at the same time, I think we will probably still look again at the information that we have and perhaps even continuing to address the problem, which is which of the cases throughout this period of time was preventable and what
exactly
to prevent all. And I think that's all encompassing. And in my opinion, and I'd love to get your comment on this one, this is probably where we're trying to get to. We know that certain variables, factors determine certain variabilities. We can address that variability, but we're also a bit more absolute and global, which is the preventability of these conditions, because we know that 80% of maternal mortality is preventable from these factors. I'd love to get your comment on that.
I really like that idea about then really zeroing in on what is it that we know and have evidence on about like what this lever for change could be, and the fact that there are a number of prevention resources and protocols already in place, and that you can identify what this number is or the share rather, of mortality that is preventable, and holding kind of a program to account against that threshold or target feels really, feels like a very concrete way of operationalizing this idea. And that I think like the health field has like a unique opportunity to do.
Okay. Well, let me pause for a moment and let's go to the Q&A box. And I see at least one question in the Q&A box. Dr. Rollins, you want to take that, or you want me to decipher it? It's actually a long question.
Yeah, you can go ahead.
I see down at the bottom, are there any policies that have not been introduced that you wish to see that you think would be significantly impacted in achieving equity at a federal level? That's the ending of a fairly extensive question.
I was going to say, I think that's the That's a lifelong.
I think that's the definition of your work, isn't it?
Yes, exactly. I think that's a question I feel like I'm trying to answer every day, and yet maybe there is no single response to that. But I think to something, Aria, that's in, if I hope I'm pronouncing your name correctly, that's in the earlier part of your question. My colleague Dashni put some links in the chat, and the brief that's called Research Within versus Outside Existing Systems is getting at this dilemma of can we mend and amend our existing policies, or do we need to, if not start from scratch, just engage in kind of radical transformation of policy systems in order to really repair the harm that's been done. And I would say we argue in that brief for kind of a both and approach.
Mhm.
You know, things move incrementally, and our policy system as it stands now is really designed for, I think, some often incremental change. And yet you can see when there is crisis and disaster, as we saw during the COVID-19 pandemic, many transformative things happened. So it feels like we have to be thinking on both of those parallel tracks and working on both of those tracks, which I think suggests a kind of really the need for a very robust ecosystem of government practitioners and researchers and advocates working, and I think it is certainly communicating much more than I think we traditionally have. I think to identify what this wish list of policies could or should be.
Mhm. I don't see another question in the, hold on a second, there's a second
And I'm
question.
going to just stop sharing so we can all see each other a bit more.
Okay, there's a second question here. Seems to me that there are constellations of factors that created inequities, and policies will be needed to respond accordingly. In your opinion, are there particular combinations of policies that might be more impactful? And that comes in from.
Yes, and hi, Krishana. It's good to see your name. And good to see many other people's names in the chat, in the participant list. Absolutely. In fact, I have a whole other portion of this presentation, if we had more time, that sort of that my colleagues and I have been trying to illustrate what this constellation of factors is. And my colleague Dashni, who put some of these links in the chat, is actually working also on a Lancet Commission project that is currently in the process of mapping out this constellation of factors that created certainly many of the health inequities that we see today. So hopefully we can all be in touch about that. But as it concerns, I think, family and child policy that we're here to discuss, we have to acknowledge that what was the motive for some of these programs and policies? Was the motive to isolate communities with, whether that's in housing policy? Was the motive to penalize certain family arrangements that didn't accord with what people in power sort of held? I think there were so many other kind of motivations and choices that were being made that are then reflected in the programs that we see today that then have gone on to create inequities. So to do the root cause analysis and go all the way back, it's not just going back to the program and policy itself, but it's maybe perhaps going back to why were those incentive or penalty structures built in? And this is that structural equity point that I was naming at the top. So I would think a combination of policies that would be impactful is, I think, kind of along the both and line that I was mentioning and that we discussed in that other brief, is that we probably need to be making these kinds of process changes that are sort of these more incremental things while we are thinking about removing or really redesigning what gets rewarded and what gets penalized. And that means probably not just limiting ourselves to the things that ACF has purview over. That means thinking about our tax policy and our tax code. That means thinking about our housing policy. That means thinking about our education policy, right? All the things that go into, in our labor market policy, that go into creating the situation where people then are at this precarious level of earnings, where they then need to rely on government, but don't have enough to then achieve the self-sufficiency that is in the name of, in name, the goal of some of these programs.
Yeah, I'm also happy that you brought up the issue of structural factors, and I think that's critical. And in fact, I think that may be the next arena where we have most of the discussion going on, because we've seen over the years that we've gone from an already health disparities to now health equity and now health justice. I'm using health justice because that's my area. But I'm also seeing too that there is a significant amount of discussions now on structural determinants. The structural determinants of health. And it really pivoted very nicely from social determinants to health, political determinants to health,
Yes.
down the much broader discussion of structural determinants of health, of which laws and policies, practices, cultural norms, all of that is coming into the fold of discussion. And I bring all of that up because I think the example that you use with the Black farmers, for example, and maybe even to some extent, the distributions of resources in general, particularly resources that might get at a problem such as maternal mortality. The question that I have is there, quote, a federal role in eliminating structural barriers? Because
Yes.
I can see where there's been a number of things happening in this current administration that really did address some of the structural barriers. But I'll give you a chance to respond to that.
Yes, I think most of these structural challenges, I think, have to be addressed at a national level and need the weight of, I think, federal purview, if not mandate necessarily. I think people don't respond well to mandates. I think they respond well to well-designed incentives. And so thinking about what is it that the federal government can be doing to reset and redesign those incentives would be, I think, critical for the sustainability for any of these structural changes. You know, it's how are we making sure that people are not being preyed upon? How are we making sure that people are not being harmed by like other new emerging mechanisms, right? That's a lot of what the federal government is, I think, plays an important role on. So I wouldn't want to say that this is just in the hands of us as researchers and advocates, but I think it really is about this full ecosystem. I would love to hear from all of you about, as I see this survey link in the chat, what would you want to hear more about? We probably have more that we've written about or in the process of writing about that we really want to make sure we're addressing kind of what the needs are and interests are in this community of researchers and practitioners. So please be specific, be wild and imaginative in the ideas that you share. And thank you so much for your time. And thank you, Dr. Rollins and Dr. Mayberry, for really excellent questions and prompts along leading up to this talk.
Dr. Balu, that was a very, very nice presentation, good discussion. So thank you very much for participating with us. I did have a last question, but I won't ask it. But if I were to ask it, that discussion of saying we cannot achieve a sustainable equity goal without addressing first and foremost structural barriers. I know that's a short answer there. Yeah. So thank you.
Thank you both so much. Thank you, Dr. Balu, for being with us today and sharing such great resources, you all. I hope you all were able to get all of those links that were in the chat. If not, again, we'll make sure that we get the information out. Thank you, Dr. Mayberry, for moderating the discussion and keeping the focus on justice, you know, and how do we get to that. So again, you all, please do the survey. Let us know your thoughts on the webinar, things that you would like to see. You can do that with the link that's in the chat, or you can scan the QR code that is here. We will continue the conversation next month talking about equity assessments. So please make sure you register for next month's webinar as well. And again, thank you all for your time. Thank you for being here with us this afternoon. Have a great rest of your day.